Okay, well, welcome everybody to our Pandia Health Facebook Live, also streamed on YouTube and probably will be cut and later put on Instagram or something else. I'm so privileged and happy today to have Saludable Latina and Lilia Ash, founder and creator of Saludable Latina, Women's Health and Wellness. And today we're going to be talking about birth control, bleeding, and fertility and pregnancy. So without further ado, I'll let Lilia take it away.
Thank you so much, Dr. Sophia Yan, for having this conversation and bringing awareness to this topic. As we know, in our women's health journey, we go through several different transitions. And often at times, I think there are women that get kind of stuck not asking the question once they leave the provider's office, and or a lingering question that they have in mind. So Dr. Sophia and Yan just are happy to collaborate to bring an informative session with questions and make this dynamic conversation flow.
So cool.
So we're going to get started with the first question because I know this is a very common question that a lot of women ask, in particular when it comes to abnormal bleeding. So the first question is, what are the consequences of abnormal bleeding on fertility or pregnancy?
So the first thing is to know what's abnormal and what's normal. And abnormal is too long, too heavy, and too long would be more than 7 days. Too heavy would be more than changing a menstrual product every 2 hours, assuming it's like soaked or something like that. And certainly if it makes you feel tired, cold, anything like that. The other abnormal is infrequent periods. So you should have a period every 28 to 35 days. If it's longer than every 35 days, then that's not normal. There's a condition, polycystic ovarian syndrome, that affects 1 in 10 women. And that is absolutely connected to your fertility. And what happens there is that your female-male hormones, all of us with uteri have both female and male hormones. But if there's an imbalance and there's more male hormones, then you get acne, you get hairiness, and you also get bad lipids and other stuff like that. But more importantly, or the one that we're focused on right now, is fertility. And so every month, a bunch of eggs get ready, one of them gets the most estrogen, and one of them pops out. But with polycystic ovarian syndrome, a whole bunch of them, and then nobody pops out. And so then a whole bunch of them keep coming, and they stick in the ovary, but they don't pop out. And if you don't pop out an egg, then you can't get pregnant. The thing I don't want people to walk away with is if you have PCOS, you can't get pregnant. No, it's just like, if you don't bleed every month, then the likelihood of you popping out an egg is lower, and there's a lower chance of you getting pregnant. But always assume you can get pregnant, because inevitably you will by mistake. But anyway, so 1 in 10 women, those with PCOS, will have a difficult time getting pregnant. And the way you have that idea is if you aren't having a bleed every single month and you're not on the birth control pill, patch or ring, then you might have PCOS. If you're already on the birth control pill, patch or ring, then that will mask polycystic ovarian syndrome or hide it. And then when you come off the pill and then you have a hard time getting pregnant, it's not the pill's fault. It's because you either got PCOS during that time or you had it before and they put you on the pill and you didn't know why.
Yeah, and I think a lot of the confusion lies in when women misinterpret that sometimes it was the cause of the birth control pill that caused me to have PCOS. And I think that's a good clarification to have, because some women could have had already an underlying condition for PCOS, like you mentioned, either not having a bleed or having a bleed and then just cycling over and over. And then once they get on the pill or come off, and then all of a sudden the PCOS comes back. And so that's a good clarification to know. And these are also good questions to ask your provider when you are getting prescribed a prescription, to see like how long you should be on birth control in case if that is part of your plan of care due to PCOS or abnormal bleeding. So thank you so much, Dr. Sophia Yan, for answering that question.
I just wanted to add that birth control pills are sometimes used to treat people with PCOS. So if you have PCOS, they'll put you on birth control to normalize your hormones. And then when you come off, that is your most fertile time. So for people with PCOS who had irregular periods, went on the birth control pill, and now want to get pregnant, the most fertile time is when you come off. Because once you come off, your hormones are going to get weirder and weirder and weirder, and that'll make it harder for you to get pregnant. But when you're on birth control pills, it actually normalizes it. And then when you come off, you'll have a bleed, and then 2 weeks later, that is the best time to get pregnant. And we also have a blog on PCOS. So if you Google Pandia Health PCOS, I have a talk on it, but more, it's a talk on different treatments. You can use metformin, you can use a birth control pill, and also dietary changes.
Yeah, and that's important to know. Dietary changes are also part of the plan of care along with birth contraceptives, which is really important. And I love the fact that you actually included getting to know us, that some patients do have to get treated with birth contraceptives to manage their PCOS, and utilizing actually birth contraceptives for a start infertility journey, which most women are not aware of, because some providers do actually prescribe to have, like you said, like that little booster to kind of help them emphasize to get on the fertility journey. So thank you so much for clarifying that. And then the other question would be how to help women navigate their wellness journey during that time if someone does get diagnosed with PCOS. I know with Pandia Health Services coming to the forefront, especially now, telehealth medicine is so vital. How do we navigate women to make sure that they're getting the appropriate services in on time when it comes to prescriptions that they need?
Yes. So given the COVID epidemic, which will probably be with us for the next 6 months at least, it's important to know the limitations of telemedicine, in that I think for PCOS, you could probably diagnose most of it through the physical exam via video situation, but certainly without a video looking, or at least without pictures of your skin and hairiness and acne, you can also diagnose it sometimes with blood tests and ultrasound, and those two things cannot be done via telemedicine. It's really important to know when you need to come in to see a physician and what can and cannot be done on telehealth. Pandia Health, we're here for birth control. We're here for preventing periods. So if you want to have a period every 3 months, every 6 months, or never, that is absolutely an option with our platform. We're going to launch acne in the near future, and maybe menopause and wrinkle cream, but we are not currently touching PCOS because there are labs that you want to get sometimes. And also there are images that we would, have to add to the system. So, but if you're doing a video telemedicine, and then they can do some blood tests, or they can do an ultrasound. Again, the ultrasound is not necessary for the diagnosis. It's just sometimes done. If you're in an OB-GYN's office and they have an ultrasound, they're like, aha, and they can just go do it. So
good to know. Good to know that we have a plan of care, like you mentioned before, it could be either medication, or like you said, like if OB wants an ultrasound just to kind of get a visual on, the reproductive organ, they can do so. And so there's many ways for women to get a plan of care. And I love the fact that you were able to emphasize on that. Let's emphasize a little bit on birth control and pregnancy, because I know this is to the forefront, especially since schools are out, and we know also too there's a rise when it comes to adolescents and engaging in sex. How does it come to the forefront to be able to have birth control and fertility information available for young women and women in general?
I think it's important to know good sources of information and bad sources of information. And so when you go to a website, you want to check, is there a physician affiliated? Is that physician academic? And, WebMD is generally trustworthy. Anything with a .edu behind it has to be trustworthy. If it's a .org, more likely to be trustworthy, though there are certainly anti-abortion, anti-birth control, anti-women websites that are .org, which is nonprofit, and they say crazy things about birth control that are not true, such as it will make you infertile. My joke is it will make you infertile while you're taking it, because that's what birth control is for, but it has no long-term effects on your fertility. Just so everybody knows out there, the pill, the patch, the ring, the IUD, the implant, the copper IUD, all of those have no long-term effect on your fertility. As soon as you come off of it, which with the pill, the patch, the ring, within 3 days, it's out of your system. But it is really important that I think anybody of reproductive age know the consequences of having sex, which is pregnancy, sexually transmitted infections, and how to protect themselves against becoming pregnant if they become sexually active. About 60% of high school seniors and 10% or 20% of high school freshmen have had sex. And if you think your kid is any different, then you're just sticking your head in the sand. So it's important that they know that if you have sex, if I tell my kids, they're young. And so I was like, if somebody with a penis and somebody with a vagina are naked in the same place together, pregnancy can't happen. So this should not happen until you are ready to make babies. But that's, an overly simplified situation, but everybody should know how to get pregnant, because it would be sad if someone became pregnant and didn't know how it happened. But they should also know about the consequences and how to prevent it. And, consent is really important as well. And so we're proud at Pandia Health that we provide a ton of information between our frequently asked questions, our blog, our YouTube about the birth control pill, patch, or ring. If you want info about the IUD or implant, bedsider.org is a great website, or I think they've rebranded as Power to Decide. Planned Parenthood is always trustworthy and dependable with respect to birth control. And certainly any .edu kind of websites. But it is really important to, if you are going to be sexually active, to know how to prevent pregnancy and prevent sexually transmitted diseases.
Thank you so much for that informative answer. Having that said, you mentioned something really vital with the patch, birth control pill, and NUA ring. It takes 3 days in order for you to get back into probably getting the system out of the birth control, the hormones. Would you say that women need to have a plan of care of how long they want to be on birth control if they're trying to plan for like a future pregnancy? Like, do you think like 5 years is too long, or less than 5 years is too little time? Like, what would you say to that, Dr. Sophia Yan?
Yeah, I think the birth control, because it leaves your body so quickly, is so reversible. And so that's what we call the long-acting reversible contraceptives, the IUD, the implant. As soon as you take the IUD out, you could go for it, though you would have to rebuild the lining of the uterus, which happens, every time you want to make a baby. So you need 14 days to build the lining up before you can become pregnant. And in the old days, the physicians would be like, you have to be off birth control for a couple months before we will allow you to get pregnant, or that's the best possible thing. Actually, like we just talked about for PCOS, the best time to get pregnant is you bleed from coming off the medication, and then you build 14 days. So within 21 days of coming off the pill, the patch, the ring, you can totally get pregnant. In terms of how long is safe or unsafe to be on the birth control pill, patch, ring, or the implant or IUD or other things, it's whatever you need. If you don't want to be pregnant in the next 6 months, I suggest you get on birth control if you're having sex more than once a month. If you're only having sex once a month, the condom plus spermicide is probably good enough for you. And then if the condom pops or anything else, throw on some emergency contraception. But if you're having sex more frequently than once a month, twice a month or every week or something, then you probably want a long-term or longer acting than just condoms and spermicide. And then in terms of how long is too long to be on the birth control pill, I'm actually advocating people be on the birth control pill, patch, or ring starting at age 2 years after you get your period. Because if you start before then the estrogen will stop your growth. And I have short little Asian daughters, so I want them to be as tall as possible. So 2 years after they get their period. So one of them's like a couple months from that now, because she started at 12 and a half. And then you can start it simply not for birth control, but so that you don't bleed every month. The only reason we bleed every month is we built that lining and we're like, is there an embryo? Oh, no embryo, bleed. And then we build and we bleed and we build and we bleed from age 12 to the 26 on average in the United States, first baby. Or for those of us who had more education or took a while to find our significant other, 35, right? And then two kids, and then bleed until 55. So all of this kind of bleeding is unnecessary. So in my world, we would be on the birth control pill, patch, ring from age 14 until 50, 55, whenever you're done with menopause. And I personally feel that those women who are on birth control through menopause or perimenopause don't feel it as much. You just come off it every 6 months and be like, am I menopause yet? as opposed to letting your system kind of sputter out. And I've heard people who had no periods and then perimenopause comes and they got flood or they got like random blood. And I'm like, if you just like come off every 3 to 6 months and check and see how it's doing, I think you're going to do a lot better than just like let it putter out on its own.
And it's good to know that women have that option, because often at times I think women sometimes feel on the contrary to take any medication, but I guess it depends on the diagnosis and symptoms, that every patient is different. And so it's always best to know what your options are and seeing what the plan of care will be along with your provider. So it's really good to know that contraceptives can help women with certain diagnoses that can help alleviate some of those symptoms, especially if they're very severe. So always have that in mind, ladies. Okay, Dr. Sophia, yeah, I can keep going with you. Okay, how does birth control help women with abnormal bleeding? And what are some potential abnormal bleeding diagnoses that you see that are very common?
So we talked about PCOS, and what's really confusing for patients is we put you on the birth control pill to regulate your periods because you weren't having enough periods. So the key thing of PCOS is infrequent periods and then a lot of male hormone. So acne, hairiness, or just if we check a blood level, high testosterone level. And so then we put you on the pill, but then the thing I just told you now is once you're on the pill, the patch ring, you could have no periods. And so know that if you're not on medication, you should have a period every month, or we got to look for abnormal causes of periods. If you're on the pill patch ring, then how often you bleed is up to you, because the way they work is 3 weeks of hormone and then 1 week of either sugar or nothing. And this week is optional. You could just keep going and never have this week, or do it every 3 months or every 6 months or every year. You don't have to do it every month. So the number one cause of abnormal bleeding other than pregnancy is probably PCOS, because 10% of women have that. But another abnormal bleeding is crazy heavy bleeding. And one thing we want on people's minds is von Willebrand's disease. It only affects in 1 in 100. So 10 times less than PCOS, but it usually shows up first period and just blood all over the bed. And so if that has happened to you, please go get checked for von Willebrand's disease. Or if you bruise, more easily than others, or when you brush your teeth, you bleed more than others, or just if you cut yourself, it takes you a long time to stop clotting. These are indicators of like von Willebrand's disease. Other causes for not having a period could be not enough nutrition. So anorexia, or just, we call it the female athlete triad, is amenorrhea and not enough calories and low bone density. Because when you don't have enough estrogen in your body to bleed every month, then you don't have enough calcium going on, and then your bones will break easier or something like that. So if you're an athlete and during the season that you're exercising, you didn't up your food, then you can lose your periods. And then you could also have a tumor in your head, that prolactin tumor or a hypothalamic tumor, or you could have a thyroid problem. A lot of older women will get thyroid, not as much in the younger women, and you can have too much or too little thyroid, and that will mess with your period. So those are the most, I think, common causes of irregular periods, be it too much or too little.
That's actually really good to know, because I know I've seen a couple of case scenarios when I used to work in a hospital where some women came with severe bleeding and they just didn't know what it was. And unfortunately, some doctors were like, oh, she's just on menstruation. So it's really good to know the types of conditions that do exist so women can become familiar for an appropriate plan of care once again. And once again, if it has to do with contraceptives, that can help alleviate some of those symptoms or severe conditions that are happening with your changes in your body. So thank you so much, Sophia Young, for that one. Okay, the next one's going to be, do women actually have more information on the types of variety of birth control pill and or access to birth control pill when they are ready to make that decision for themselves?
So the question is, do they have it or should they have it?
Should they have access to birth control?
I absolutely believe in access to birth control. That's why I founded this company. We bring birth control to wherever you have internet and a mailbox. And it's about care, convenience, confidentiality. It's none of anybody else's business why you're using birth control. It may not be for birth control, as we discussed. It could be you have some horrible bleeding disorder. And if you were to bleed every month, you would bleed out and need, a transfusion every single time. And that would be a waste of money for the healthcare system if we could simply treat that by turning off your period so you don't bleed out every time you get your period, right? And I do think it's important that women have all their options available to them. So if you're using a birth control telemedicine company and they aren't giving you the pill, the patch, the ring as your options, then that is not standard of care. We obviously cannot provide the IUD or implant, because those you have to come in to get the IUD in your uterus or the implant in your arm. Maybe in the future we'll have a drone that drops off a robot doctor that says, spread them. But right now we don't have that. And so, but at least make sure if you're using any of these platforms that they are offering you the pill, the patch, the ring. And if they're not offering you all three, then something's fishy. Because as a doctor, I can write whatever you want and I can send it to whatever pharmacy you want. Certainly, my company has both the doctors prescribing and a pharmacy delivering. And on the pharmacy side, we may not fill the patch or the ring, but I can still write it for you and send it to whatever pharmacy you want. And if you paid for that doctor's visit, you should have the ability to get informed consent or to get all your options, and that the provider that you're talking to shouldn't be pushing a particular drug. You should watch out that they aren't affiliated with a particular drug company. If they're on that drug company's website, then there may be an issue. Or if you got referred from a drug company's website, then they're probably going to push that for you. And then look at who is the CEO, who is the founder, right? At Pandia Health, we are the only women-founded, women-led. We are the only doctor-led, meaning doctor CEO. And I've taken the Hippocratic Oath, do no harm. Whereas I can't say the same for my MBA lawyer and other startup types that are here just for the money. We're here to give women information. There's some stuff that you as a consumer don't necessarily need to know. You don't need to know all 40 different birth control pills. You do need to know that there are 40 to choose from. So if one doesn't work for you, there's 39 other ones you could try. You should know, and most people don't know, that there's 8 different progesterones. So again, if you don't like this birth control pill, know what the progesterone is in and tell the doctor, I was on drospirenone, or I was on levonorgestrel, or I was on norethindrone. Or even if you don't know, at least keep the pack. And so when the doctor says, what have you been on? You'd be like, this one I did not like because it gave me zits, or it gave me munchies, or, whatever side effect you have. And know that there's 7 other ones that you can try. And then the new thing that I recently learned, and I knew it, but it's kind of in the back of your head, that they have levonorgestrel, but sometimes it's 30 micrograms and sometimes it's 20 micrograms. And that's, 50% more. So it may be bad at 30 micrograms, but if we took it down to 20 micrograms, it will have half or 1/3 of the side effects. So it's just something to keep in mind. But, the irritating thing to a physician is when a patient comes and they go, I want this pill. And it's like, did you study all 7 different ones? Certainly you can always ask for whatever you think is best for your health, but don't get sold by a drug company that's saying we're good for acne, because actually all of the pills are good for acne. But there are some that are better than others, but that's not necessarily what the drug company is going to tell you.
Good to know. And it's always good to know that we have many options. And always, ladies, as a patient yourself, do a little bit of navigation, education. Pandia Health has a Facebook where they do live educational videos. You can research the website and navigate to make sure that you're making an informative decision that will be part of your plan of care. Having that said, since we are in the COVID-19 pandemic, how do women navigate COVID-19 and medication during this time?
Yeah, so we're really happy that we are all online and that we are allowing women to hashtag skip the trip to the pharmacy. So you don't have to go to the pharmacy, get coughed on while you're waiting. We calculate that women spend 10 weeks of their lives going to the pharmacy, waiting for the drug, and coming home, and hashtag better things to do. That's really, one of the key reasons we created Pandia Health. One is what I call pill anxiety, the fear of, holy crap, I'm going to run out of my birth control and there will be a dire consequence, and thinking about that every single month for 40 years of our lives. And then the second one, going to the pharmacy, everything else comes in the mail. Why the heck not my birth control? So during COVID, if you can, just take the telemedicine visit, take the delivery service, as long as it's affordable. And under Pandia Health, it's just $20 once a year to use our expert doctors. And then you have access to them for the whole next 364 days if you have any follow-up questions or whatnot. And then if you enter code Pandia, it's $5 off your telemedicine visit. And the delivery part, if you have a prescription, just tell us where it's at and we'll move it to our partner pharmacy. Give us your insurance information. We'll bill your insurance, ship it to your door, done. You pay us nothing. If you have an active birth control prescription and insurance to cover the meds, you pay us nothing for free delivery, automatic refills. And once a year, we'll remind you, go see your prescriber. Because if the prescription expires, it's in our interest that you get a new one so that we can continue to deliver. And so because of that, we complimentarily knock on your shoulder and go, hey, go get your prescription, go see your provider, go get another one. And then in California, Florida, Texas, Arizona, Wyoming, and we just added, hello, Colorado and Georgia, and we're going to add some more states in the new year. We can prescribe for $20 once a year. And all the other 50 states, we can absolutely deliver.
Well, there you go, ladies. You got some of the questions answered by Dr. Sophia again. So if you have any additional questions that you want to navigate through the website, once again, she does Facebook Lives on Tuesdays with different topics and different guests. And this will be the moment and opportunity to get educated on your different types of services available now that we're going online and telemedicine is here to stay. So be mindful of that.
Thank you so much, Lilia, for coming on, and you've been an amazing hostess. And I know that you also have a discount code that you're offering of womb to get $5 off a womb meditation if you go to Saludable Latina, right?
Yes, absolutely. So I do provide womb meditations for women because, as we know, in our different transitions in health, sometimes we just need a little bit of that relaxation when we're feeling stressed out in our minds and our bodies. And it's also really good to know that we can also do this while on medication too. I think there's a misconception too that if you're on medication, you can't connect to the mind, you can't connect to the body, but there's different ways to apply those tools to be able to be in good harmony with your plan of care and your health and making decisions to navigate along the way. So if you would like to join, yes, $5 off the next womb meditation, which will be taking place on January 2nd at 7 p.m. So if you want to join that one, and we'll have information available.
Very cool. Well, please check out Saludable Latina website, Facebook, Instagram, and please share with everybody you know Pandia Health. Again, we're the only women-founded, women-led, the only doctor-led company in birth control delivery. And we're here just to make women's lives better. And every Tuesday, usually at 5 o'clock in Espanol, 5:30 in English, talking birth control and everything vagina, and always welcome comments.
I love that. And don't forget to catch their latest podcast episode with Dr. Sophia yet on SoundCloud and iTunes. We do talk a little bit more into depth into Pandia Health Services and talk a little bit more into women's health as well.
Yay. All right. Well, we'll see everybody in another minute in Espanol on the different link.
Absolutamente.
Adios.
Bye. Adios.